Yes, sir. Good evening. This was a survey conducted by AIOS and IJO on psychosocial well-being and professional well-being. So we had about 62% response rate of those who opened the email and clicked on the SMS link. And until I analyzed at 3 p.m., there were 1,950 responses. Majority of these people happen to be practitioners. As you see here, 80% are practitioners, and postgraduates also were there, and they composed a minor number. Now, there was a pan-India distribution with representation from all the states and union territories. 75% of ophthalmologists or respondents were in metro or tier 2 cities, and rest of them were distributed elsewhere. Solo practice and family or group practice constituted about 40%. Corporate employees were 20%, and NGOs, etc., were another 20%. Now, who is affected and how? If the question asked was, if you are a PG student or a fellow, is your training affected during COVID-19? And the respondents were 413. And a majority of them said that their training was considerably or completely affected. The second question that was asked was, if you are a PG student or a fellow, is your teaching institute supportive during COVID-19? There were not responses which to the tune of about 63% who said that their training institutes were not at all supportive or were somewhat supportive, which actually parallels to what we saw earlier, that is, their training is affected. So institutes which are not supportive of postgraduate students have resulted in hampering of training quality. During this period, of course, they had no other choice. As far as the employees are concerned, the question asked was, if you're an employee, is your employer supportive of you during COVID-19 times? Majority of them responded saying that they were either considerably supportive or completely supportive. So this is a very good response, indicating that about 73% of employed ophthalmologists were considerably or completely supported by their employers. Has your income been affected during the lockdown? Obviously, yes. About 40% of ophthalmologists said that their income was down by 75 to 100%, and 50 to 75%, another 10%. And 35% said that their income was not affected at all. These were mainly salaried employees or pensioners. What about the monthly living expenses? Are you able to meet that? Majority at this point in time are able to meet it, but a minority of them, about 30%, are not able to meet it adequately. They are finding it difficult to meet the monthly expenses at this point in time. What about if the lockdown extends to 3 months or 6 months more? Are they able to have enough cash reserve so that they can at least meet their monthly expenses? About 37% are able to have a deep, about 10% are able to have a deep pocket to be able to meet their expenses for over a year. But others, about 50 to 60%, are not able to meet it beyond 3 months or 6 months. So that is the kind of liquidity they have personally. And are they worried about post-COVID situation? Majority of them, about 90% of them, are worried significantly or considerably. 10% are not worried. And what is the state of mind? We use two questionnaires. One is PHQ-9, which assesses the level of depression. It has 9 questions and which can be graded. We also use the modified Warwick-Edinburgh mental well-being scale. And according to that, there was moderately severe or severe depression in 22% of individuals who responded, which is much higher than that of general population. It's about 10% in general population, having adjusted for age and the professional level of training. This is 22% at this point in time. This is in the last 2 weeks. We did not go for a long-term depression assessment. Very important was the suicidal thought. 91% were absolutely okay, but 6% experienced very severe suicidal thoughts once or twice a week in the last 2 weeks. 3 to 4 times a week, 2%, and these were really on the brink. 1% of them are experiencing very significant amount of suicidal thoughts every day. So these obviously need some help. In fact, all these 9% of these individuals will need some sort of help at this point in time. So what are the bad things about the survey? Training was affected in about 2/3 of situations. Income, more than 50% was affected in more than half the individuals, for more than half the individuals. About 3/4 of them were very worried about the future. 22% are significantly depressed. 9% are having suicidal thoughts, and 1% are really on the brink. But what is good about the whole thing is that employers are supporting in about 73% of situations, and training, obviously it's not possible, but still about 37% of the training institutes are very supportive of their postgraduate students and fellows. So what we now have to do is to reach out, and we are trying to form a small online triad system with selective counseling via small group, including like-minded ophthalmologists, clinical psychologists, and counselors, so that these people who are on the brink and who are very severely depressed can be helped. Thank you.